A hearty good afternoon and welcome to this session of Tubal Factors and Fertility. We are glad to have Dr. Sita Sharma among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Good morning. Thank you. Good morning, viewers. I'm Dr. Sita Sharma from Apollo Cradle and Fertility, Amritsar. I'm a senior consultant here in Apollo Fertility. Today, we will talk about the tubal factors. How are tubes helpful in conceiving, and how will tubes cause problem in conception or infertility? Infertility is a problem when a couple is trying to conceive for the last 1 year. They are trying to conceive without using any mode of contraception. Still, they are not able to conceive. It is labeled as infertility. If the age of the woman is 35 years and then we take this period as 6 months, in other words, I can say if you are trying to conceive for the last 1 month and you are not able to conceive, then after 1 year of trying, it is a need to consult the doctor. After 1 year, you need to get some investigations done so that we will come to know what are the problems which are causing you not you why you are not able to conceive. So the problems can be in male and problems can be in female. And in female, I will talk about the tubes today. So what are the tubes? The fallopian tubes. This is a diagram to represent what I'll just tell you what are the tubes. This is the uterus, the center one, and these are tubes. These two are fallopian tubes, one on each side, right and left. So these are ovaries. So I will talk about the tubes today. ये tubes होती क्या है? There's a pair of tubes on the right and left side. One side it is attached with the uterus, and the other side the tubes is a fan-like structure, or it is just like a wicket keeper. It is sitting on the ovary. So what this wicket keeper or the femoral end of the tube does, it catches the egg which is released from the ovary. So the function of the ovary is to release the egg, and when the egg is released in mid cycle, in almost mid portion of the menstrual cycle, the egg is released. This egg is taken up by the femoral end of the tube, and from this end, this egg reaches almost mid portion of the tube. And when you have physical intercourse, the sperms are released in the uppermost part of the vagina. They travel through the uterine cavity and the tube, and they reach at the almost mid portion of the tube. So these tubes are the site of fertilization. They are the site where the egg and the sperm will meet. So this is a very important organ, because the egg and the sperm are meeting at this place, and this is the site of fertilization. So fallopian tubes are the site of fertilization. This is the site from where the egg and sperm will meet and the embryo will develop. The young baby, the ankurit baby, that will develop, and these tubes are now they will nurture the baby for few days more. Here, after 5 to 6 days, they migrate the zygote, or they migrate the embryo through the on the other direction to the uterus now. Firstly, the sperms were migrating through the uterine cavity to the sperms, and now the embryo is migrating from the tube to the uterus, because uterus is the site for implantation. Tube is not the site for developing the embryo. Tube is not the site for implantation. The site of implantation is the endometrium that lies within the uterine cavity, and now the baby will develop inside the uterine cavity. So if the tubes are damaged, if the tubes are not open, if the tubes are closed, so then the tubes will be a cause of infertility. You will not be able to conceive because you have pathology in the tubes. That is around 25 to 35% of the cases. The cause for not conceiving lies in the tubes. Tubes में क्या क्या causes हो सकते हैं? Number one, there can be infection. There can be endometriosis. Endometriosis is not actually a disease of the tubes, it is a disease of the ovaries, but tubes are also involved in it. And number three, if there will be some surgeries. Surgeries can be on the tube, or the surgeries can be around the tube in the pelvis, which can lead to tubal adhesions, and later on it can lead to tubal blockage. So tube होता क्या है? Tube is a kind of duct. It is attached from one end is attached from the uterus, and other end is attached near the ovary and femoral end of the tube को एक proper relation में होना पड़ता है, so that when the egg is released from the ovary, it is the tube is almost engulfing on the egg. The egg is released inside the tube only, so that egg catches itself. Egg is reaches the tube, and from there the sperms come from the other end. And if the tubes are patent, if the tubes are open, there will be fertilization, and there are chances you will conceive. So how will you come to know that your tubes are open? What are the various tests? So you see, pregnancy is a sure sort test that you are pregnant. Once you get pregnant, that means that is a surety that your tubes are open, because you will conceive only if your tubes are working and patent. Other tests are hysterosalpingography. This test is done in the postmenstrual phase. Postmenstrual means once you have completed your periods, and then we ask you to get your tubes test done. And what we do, we this inject some dye through the uterine and cervix, and this dye will fill the uterus first, and then it will go through the tubes in the peritoneal cavity, that is in your abdomen. And then the x-ray picture is taken, and this x-ray film will tell us if the tubes are open or not. If the dye went through the uterine cavity to the tubes very smoothly, and it goes out, it is seen on the image, then that means the tubes are open. If there is some problem, if there is even during hysterosalpingography, we come to know about other problems with the uterus and with the tubes also. Sometimes the tube one tube is open and one tube is closed, so that will be clearly seen on this. And sometimes what happened, the whole of the tube is okay, but the fimbrial end is not working, that becomes closed. These fimbrias, they close, and then this dye will accumulate inside the tube, and that will give you a picture of ballooning of the tube, that is called hydrosalpinx. So this is a problem with the fimbrial end of the tube. So we can get the tubal patency test done in the post-menstrual phase once you are over with the periods, and also it is confirmed that you are not pregnant. And you feel less pain if it is done in the post-menstrual phase, because the mouth of the uterus is almost open because of the periods. And secondly, it also rules out that you are not pregnant. Other method we can do the tubal patency test is with sonosalpingography. That when we do ultrasound of the patient, we inject saline through the cervix, and then we see the opening of the tubes, whether it is open or not. And the gold standard procedure for tubal testing is the laparoscopy. Diagnostic laparoscopy, we put a under this procedure is done under anesthesia, and of course in the post-menstrual phase, menses के बाद करते हैं. Patient is called empty stomach, and patient is put under general anesthesia. A laparoscope or telescope is introduced through the umbilicus, and then we see the tubes. We can see the uterus, tubes, ovaries all as well. And it is a preferred mode. हम तब करते हैं लेप्रोस्कोपी जब हमें लगता है कि पेशेंट को there can be possibility of endometriosis or possibility of some cyst, or possibility if the tubes are previously were open and then the patient has undergone some surgery, like जैसे myomectomy हुआ है, fibroid का removal surgery हुआ है, जब ट्यूब्स के ऊपर ही कोई प्रीवियस सर्जरी हुई थी, जैसे कोई एक्टोपिक प्रेगनेंसी हो गई थी, व्हेन प्रेगनेंसी इम्प्लांट्स, यहाँ से प्रेगनेंसी स्टार्ट हुआ, वेयर इज द साइट ऑफ फर्टिलाइजेशन, एंड इट डेवलप्स for few days and then it goes inside the uterus. This is a normal course of action. Sometimes what happens, there is some pathology in the tubes. The cilia जो tubes की lining होती है, they become some defective due to infection, and this egg, fertilized egg or embryo is not able to migrate to the uterus. It implants within the tube only. जब ये ट्यूब में इम्प्लांट हो जाता है, तो इसको एक टॉपिक प्रेगनेंसी बोलते हैं, या ट्यूबल प्रेगनेंसी भी बोलते हैं, बिकॉज दिस इज नॉट द नॉर्मल साइट ऑफ प्रेगनेंसी. नॉर्मल साइट ऑफ प्रेगनेंसी इज इनसाइड द यूट्रस, बट जब ये गलत जगह पे हो जाती है आउटसाइड द यूट्रस, तो इट इज कॉल्ड एक्टोपिक प्रेगनेंसी. Ectopic pregnancy can be managed with medicine, or sometimes we have to go for surgery. सर्जरी में या तो ट्यूब को बचा लेते हैं, जहाँ ट्यूब निकालनी पड़ती है. सेल्फिंजेक्टमी इज रिमूवल ऑफ ट्यूब, जहाँ समटाइम्स हम लोग सिर्फ कंजर्वेटिव ट्रीटमेंट कर सकते हैं, जबकि प्रेगनेंसी जो है टॉपिक प्रेगनेंसी उसको निकाल दिया जाता है. वी सेव द ट्यूब बाय डूइंग सम काइंड ऑफ anastomosis or some kind of we sometimes leave it as such and the nature heals it. Salpingostomy. So sometimes the tubes are repaired in order to just remove that blockage at one part. And कुछ patients में tubal surgery हुई होती है पहले, मे बी ट्यूबल लाइगेशन ऑपरेशन पहले करा लिया होता है, फैमिली कंप्लीट है, वो शुड गो फॉर ट्यूबल लाइगेशन। तो ट्यूब्स को जब ट्यूबल लाइगेशन के ऑपरेशन में इन ट्यूब्स को दोनों को ब्लॉक कर दिया जाता है, just to so that couple does not want to conceive again. So this is a permanent method of sterilization. इन केसेस में भी अगर दोबारा से कंसीव करना चाहें तो हमें सर्जरी करनी पड़ सकती है, that is called tubal recanalization, which is not done so frequently nowadays because of the routine and good results seen in the IVF. सो अब है कि किन पेशेंट्स में लेप्रोस्कोपी करनी चाहिए। लेप्रोस्कोपी शुड बी इज अ गोल्ड स्टैंडर्ड प्रोसीजर टू नो अबाउट द ट्यूबल पैथोलॉजी एज वेल एज टू ट्रीट द ट्यूबल पैथोलॉजी। एंड ट्यूबल दिस लेप्रोस्कोपी इज डन इन पेशेंट्स who have more than 1 year of infertility, who are trying for to conceive, and who have all the other factors are ruled out. That means they already have normal ovulation, semen factor is normal, there is no other reason for not conceiving. Then we try to look about the tubes. We go for diagnostic laparoscopy and hysteroscopy. When we do hysteroscopy is the inside view the inside of the uterus, and from the inside we will see the tubal ostia. We just see that the uterine cavity is fine, the tubal ostia are fine. When we put laparoscope from upward from the umbilicus, then we see whole of the uterus, we see tubes, we see ovaries and tubo-ovarian relations. So when we do laparoscopy, then we will see about the patency of the test. We put a dye from below, and it is seen that whether the dye pass through the tubes or not. So dye will go in the uterus, and then it will pass through the tubes, and it will be seen directly on the laparoscope that it is coming out of the femoral end of the tubes. That means the tubes are open. So that will show not only the patency or opened tube, but also it will show about the functioning of the tube. We would like to see that if there is any other pathology within the pelvis, like कोई adhesions तो नहीं है, कोई ओवरी के अंदर सिस्ट तो नहीं है, कोई ट्यूबो ओवेरियन मास तो नहीं बना हुआ, जो ट्यूब्स हैं वो यूट्रस के साथ या ट्यूब उसके साथ पेल्विस ऑर्गन्स के साथ चिपकी हुई तो नहीं है. So that will we come to know all the pathologies. And if there is some kind of thing we can manage, like if there is any endometriotic cyst, we can drain the cyst and we can do cystectomy. We will bring back the tubo-ovarian relationship. So that is what we can do. So when a couple come to us with the problem of infertility, after doing the couple counseling and after doing the routine test, we look to try to do transvaginal scan. We do in a female. Transvaginal scan will tell us about the normal uterine cavity and about the normal ovulation when we do serial ultrasound. But the normal tubes are not seen on the ultrasound. When the tubes are seen, they are always diseased. They can be having some hydrosalpinx, or there can be some kind of it is swollen or it is involved in some kind of adhesions. Only then we will be able to see we will be able to notice there is some problem in the tubes. इन्फेक्शन की बात करें तो कौन कौन से इन्फेक्शन है जो ट्यूब्स को प्रॉब्लम कर सकते हैं. इन इंडिया द कॉमनेस्ट इन्फेक्शन इज ट्यूबरकुलोसिस. सो ट्यूबरकुलोसिस ऑफ द जेनिटल ट्रैक्ट, मोस्ट कॉमन साइट ऑफ इन्फेक्शन इज द ट्यूब्स. ट्यूब्स के अंदर जो ट्यूबरकुलोसिस है वो स्वेलिंग भी कर सकती है, दोनों ट्यूब्स को ब्लॉकेज भी कर सकती है, ट्यूब्स को सुखा भी सकती है, विच इज कॉल्ड ट्यूब्स बिकम वेरी स्पास्टिक, अकड़ जाती हैं, जैसे दे बिकम्स बीडेड अपीयरेंस. So they are not working, even they may be open but they are not working. So tuberculosis, and then other infections are chlamydia. Chlamydia is also a kind of infection which travels during the sexual relations only. So chlamydia is one infection which can damage the tubes. And patients who have a history of repeated abortions, who have repeated even ectopics, sometimes some patients have repeat ectopics on the right side, then on the left side, then again they can have some at some other side. So in those cases there can be possibility of the infection. So the main causes by which the tubes are damaged is infection, previous surgeries, and endometriosis. So what should we do now when we come to know about that? We go for the hysterosalpingography test, which is done with the help of the X-ray, and a dye is injected, and then it is done in the postmenstrual phase. If the tubes are open, then we just counsel the patient and we ask them to take some more time for natural trying, or we can go for IUI. IUI is intrauterine insemination. In those patients who are less than 35 years of age, at least one of the tubes should be working, one of the tubes should be opened. And male factor, there should be only mild male factor infertility. Count should be around 6 to 10 millions per ml, and there should be more than 40% motility. So only and one should, at least one tube should be opened, and woman should be ovulating. So these are the patients where IUI will help. But once the tubes are not patent, if the tubes are closed, the result of hysterosalpingography is that there is blockage. Bilateral, both sides of tubes are blockage. The only answer to these couples is to go for IVF, because what the tube does in the body, we will do it in the lab. Tube is the site for fertilization, and what we'll do in IVF, we will take out the eggs by, we give injection to the woman starting from second day of the cycle. 9 to 10 days injections are given, and eggs are made, follicles are made in the ovaries. Then we collect the follicles in the IVF OT under anesthesia through transvaginal scan. We put a needle here and we'll suck out all the follicles, and these follicles are given to our embryologist in the IVF lab. Embryologist will study all these follicles and will grade the ova released. Will find the ova in the follicles, and once the ovas are found, then they will look for whether they are mature or immature. Then these ova are mixed with the semen of the husband. This is called IVF, in vitro fertilization. So what the tube was doing inside the body, now IVF lab is doing, the sperms and eggs are being meet. So once they meet, there is fertilization, and once there is fertilization, there is formation of the zygote, then the embryos. So now then we will put the embryos in the uterus at a specified time. So these embryos are put inside the uterus, inside the uterine cavity. Once we find that endometrium is favorable and healthy, lining is healthy, then we put these embryos inside, and then now the embryos will start growing. So IVF is a answer to your solution once you have tubal blockage. And mind it, if there are other factors ruled out, like if you are a young couple with no other factor, only tubal blockage was there, the result of IVF are really very good. And if there is after, before some time we used to do tubal recanalization also. Nowadays wide availability of the IVF and the results and vitrification, embryo freezing facility, the promising results of the IVF, patient usually now they go for IVF, not for the recanalization. What we do in recanalization done in those couples where the tubes were blocked, or tubes were rather ligated by their own choice, because first they found that their family is complete and they undergo tubal ligation. So tube is cut, a loop is made, and then the tube is cut. Some portion of the tube is lost in this case. So if the patients, they have at least 2 centimeter of the tubes from the proximal end, and then these patient recanalization can be tried. Recanalization can be done by open surgery, or it can be done by laparoscopy, where we anastomose और जो इन दोनों ends को जोड़ देते हैं. We stitches, apply the stitches on these two ends. Once we clear the block here, clear the ligated portion here, the tubes then start working, and then the couple can conceive, and they can show good results in some of the patients. But now IVF is the best option. So if a patient has a previous surgeries like myomectomy, ट्यूबल सर्जरी, ट्यूब के ऊपर सर्जरी हुई है, जैसे रिकैनलाइजेशन होगी, they sometimes increase the chance of the ectopic pregnancy as well. So that is why we prefer IVF but more than going for recanalization. Some people ask me, like when they come with the report of blocked tubes, the first question they ask is, क्या हम ये ट्यूब्स को खोल सकते हैं? So the tubes can be opened. We can, the next step we go is for diagnostic laparoscopy and hysteroscopy. We can try opening the tubes sometime, and sometimes we are successful also. What we do hysteroscopy, and we put a cannula here, and they cannulate the tube through the tubal ostia from inside, and then we see from laparoscope, and we see if the cannula comes out. So it's a very soft catheter which is used for tubal cannulation. But what happens, it sometimes once it is done, if the pregnancy is not conceived within a stipulated period, then they can get blocked by its own again. If there is endometriosis, grade 1 and 2 tubes are open, then we go for IUI and ovulation induction and IUI. And if there is grade 3 and grade 4, more of adhesions are there, the tubo-ovarian relationship is not there, preserved there, and the egg which is released from the ovary will be get entrapped in the adhesions. It will not reach the tube itself. The tubes is also sometimes damaged, and because of the adhesions from outer adhesions and inner also damaged, so the egg will not travel. So that basically there will be a non-union of the sperm and egg. So there will be not be couple will not be able to conceive. So in those cases, diagnostic laparoscopy and try to do adhesiolysis. We try to maintain the tubovarian relationship as clear as it was natural before, and then we ask the couple to have a try for going for conception, or we use IUI. In grade 3 and grade 4, the adhesions are very dense, and it is better to go for IVF in those cases, because in endometriosis the eggs in the ovary, or you can say ovarian reserve, is also less, so they have not more time to conceive, so they have less time to conceive. We ask them to conceive as early as possible, and we try to help them out with IVF. So this is all about the tubal factors. So tubes are very important organs, and they help in conception, because the name in vitro fertilization is taken when the tubes are not working. First and the first indication for going for IVF is tubal blockage, and there are other many indications like severe male factor or severe endometriosis, previous pelvic surgeries. And then so in those patients where tubes are not working, one have to go for IVF, and IVF is giving a very promising results nowadays. We can go for it. I think that's enough for today. And if there is any question from the viewers, I'm really here to answer all these questions. Okay, there are no questions. Okay, good afternoon, everybody.